This is Flashpoint, the voice of national unity, and I'm David Coty. We are here at ELBC 99.9. As usual, I have medical practitioners here to discuss medical problems to help you help yourself. And today is no exception. I have in studio Mrs. Sophie Parwon, and she's the CEO of the Benson Hospital, the ever popular Benson Hospital. I know you've been hearing about it. Some of you have been there for treatment. This is a duplicate role, but she's going to tell us more about it. I'm going to have another person here, Dr. Kiswahili, Eli Kiswahili. He's been here on many occasions, but on a different mission. But today, he's going to be joining Mrs. Parwon to talk about the Benson Hospital. And so today, please, as usual, we're going to have 30 minutes of discussion and then 50 minutes for you, the public, as usual. And we'll come back to our guests to respond to your questions. Our major topic today is high blood pressure. You know what it does to people. High blood pressure can lead to stroke, it can lead to heart disease, and so many things. Even those of you men who complain a whole lot about erectile dysfunction, to make it simple, sexual weakness, or my man who is not working. High blood pressure is also one of those things that can be responsible. So Mrs. Parwon is going to be able to help us help ourselves today. Mrs. Parwon, welcome to Flashpoint.
Thank you. Thank you for the opportunity, and thank you for your persistence.
Oh yeah.
I know
And I like the way
you got me to this point. I
Right.
really appreciate it.
Right. And I like the way you put it, your persistence. I kept knocking at your door every time. Please
Yes.
please come. And thank God you are here. We're also going to talk about the revamping or upgrading of the clinic, the hospital. So please introduce yourself, Mrs. Parwon, to the public. They'd like to know who you are before we can start.
Thank you. I'm Sophie Parwon. From a health background, I started my career as a public health nurse, transitioned to public health management, to so many different things. I worked with different institutions in the health sector.
Okay.
USAID, I was the deputy health team leader for about 6 to 7 years.
All right.
And then I left and went to the Ministry of Health and managed the Global Fund Ministry of Health project for 6 years. And transition, actually changed career goal a little bit and went into the private sector. This Camonex International Private Sector Project is the last project I did as the chief of party. And now I am at the Benson Hospital as the CEO.
The CEO.
Yeah.
Okay. Thank you for the brief introduction. Like I said to the public, our main topic today is high blood pressure. And you know what it does to people. Or if you don't know what it does, Mrs. Parwon is going to be able to help us help ourselves. Before we get to the topic, the main topic, I have heard that you have upgraded the hospital. Tell us about it. What are some of those things you have done to upgrade the hospital?
Good. So on March 25th, the Bensons outsourced the hospital to me for a period of 5 years.
Oh.
Yeah. So that hospital was about to close. And because I was working in the private sector, working with private health systems, strengthening health systems, Mrs. Benson called my attention and said, look, we are about to close this place. And I said, oh no, this place is strategically located.
Yeah.
It's serving majority of the population fall within the low income category.
Yeah.
You know, when this facility is closed, it's going to affect a lot of Liberians.
Yeah.
So it's going to affect, the population and everybody. So then they decided, well, we discussed, and then they outsourced it to me for a period of 5 years. So my role is to rebrand and revamp.
Okay.
When you are rebranding and revamping, meaning something was broken,
Yeah.
and you want to fix it to another level. So since I started, Uh, we looked at the
Just
statistics.
one minute. Dr. Eli?
Yeah.
Please put on the marks.
So we looked at the data before March 24th, March 25th this year. The clientele had really reduced. I think it was around 300. So between April and now, the last number we have, July,
Yeah.
our number have the outpatient intake has gone up to about 755.
Oh, sounds good.
Yeah, and we brought on board new clinical staff. Dr. Ilya is our medical director. We restructured the leadership. So now we have administration, medical services, and finance. And each of those structures have their leaders with staff under them who with different reporting lines. But in between April and now, what have we done? One, we moved from the little emergency room to a new emergency room.
Oh, good.
When we we're equipped equipment. We have oxygen concentrator, we have adequate oxygen, we have monitors. So and then we have, in terms of staffing, we have a specialist. We have two specialists now, one family medicine specialist. We are onboarding, hopefully, OBGYN specialist. We just signed a contract with a pediatric surgeon. Yes, so children with surgical issues, children needing specialized care will now be getting those type of care. But most importantly, we really reform our laboratory.
Okay.
So right now at Benson Hospital, we are doing tests equal to Jamali, JFK, and anywhere else.
Oh, good.
So we do different types of tests, and my medical director can talk more about that.
Yes.
But all the tests that people go to Ghana for are now done in our laboratory. So we established a partnership collaboration with BioLab. So they moved into our building.
Oh.
And so we're working together with them. Okay. And so that's one big one. We also transform our delivery. Most of the women come over there to deliver, and they need to deliver in a place where they feel comfortable.
Yeah.
So we found the entire delivery room and added additional delivery midwives.
Oh, okay.
We are also bringing on board by September 1st, we'll have someone who will be responsible for family planning and reproductive health. So that we can run 24-hour service, family planning and reproductive health service. Thank God DKT is coming in to partner with us, and so we'll have a real proper setup. DKT is the international organization in Liberia that is responsible for family planning products.
Oh, okay.
Yeah. So with all of our staff are now in uniform. Nurses, security, hygienists, and different cadre of people when you come. Yes, and even our medical doctors and everybody properly attired. We also started to do painting. We started with the emergency section, and we're doing cleaning. Yeah. So in fact, LMDC came to us last week, and they were very impressed with what they saw. So the hygiene component is something that we have worked on.
I like that cleaning part. All of the other ones are important too. The reason why I like it is that when you are sick, you go to a hospital. The way the place looks can help to drive away half of your problem.
Yeah.
And the nurses you have, the way they even receive you, can help. Mm-hmm. And I will talk to you about customer service. You need to tell us about that. But before that, the program is Flashcard, the voice of national unity. And I'm David Coty. I've been sitting today, Mrs. Sophie Parwon, and along with Dr. Eli Kiswahili. Yeah, I'm going to miss your name today. No, This program is also on Facebook, on my page. We have 6.4K now. That's 6,400 people who are following. You can go to David Coty on Facebook. It's Koretie to watch the program live. By this evening, it's going to be on YouTube, where you can watch it from time to time. Thank you. We'll come back to you.
Okay.
Because I want to know more about the clinic. I'm the hospital. I want to come back to you. But Dr. Swahili, Swahili.
Yeah. Thank you.
Now, our topic today is high blood pressure.
Okay.
Can you tell the public actually what high blood pressure is?
Well, I think we have discussed this topic several times, and then we need to repeat, in order to educate our people. Yes. Well, as we all know, high blood pressure is a chronic medical condition where the force of the blood against the wall of the veins is getting resistance.
Okay.
Yeah. So, and we can diagnose it, view the value of this pressure going up. The normal range is 120/80, and then when it's around 140/90, we can start thinking about high blood pressure.
Okay.
Yeah.
Now, what are those diseases that can result to, the high blood pressure can cause? What are some of them?
Basically, high blood pressure we call it a silent killer, because it can affect almost all the organs from head to toe. Yeah, so cardiovascular, it can affect the heart and the veins. We call it cardiovascular disorders. And then this can cause, first of all, coronary issues, and then maybe a normal jargon, heart attack. Yes, it can lead to heart attack, and then heart failure, and sometimes aneurysm. So these are big jargons, but you can retain the heart attack and heart failure. Yeah. So it can also affect the brain. Okay. Yeah, cerebral disorder. So what we call stroke.
Yes.
Yeah. So those are the condition pressure can lead to if it's not well managed. And then it can affect also the kidney.
The kidney?
Yes. Yeah. Chronic kidney disease, and then, kidney failure, why not? And then it can affect the eye, causing, glaucoma and, and what have you. So, and also it can affect the peripheral nerves, peripheral, vascular disease. So for head to toe, as I just mentioned it, pressure can destroy, right? It can destroy all the organs of the body. So we need really to be careful and monitor, visit the hospital on time. Benson Hospital, we are now equipped with the new management. We are doing well. The patients are really getting the needful care they need. So people are welcome to come to check their blood pressure. And to be honest, the statistics are really high. I can say 75% of our patients have high blood pressure issues or high blood pressure complicated related conditions.
Yeah.
The one I just mentioned.
Yeah.
Yeah. If you have 10 patients on a ward, maybe 7 have these issues related to high blood pressure. So high blood pressure is a real concern to our population. People should check their pressure. They should visit the hospital, not only when they are sick, but they can come from time to time to do their checkups. As the CEOs mentioned, we have specialists now on board who can come and do your checkup. You can just fix your appointment, and then you will meet with the specialist to check, and you will do the needful test to really get what the issues you have, so we can tackle the management appropriately.
Sticking on high blood pressure,
yeah,
I know that high blood pressure can also cause erectile dysfunction.
Yes.
And this is a major problem around the world. In fact, 25% of the marriages in America break up because of sexual incompatibility.
Yeah.
Now, so you are advising people who are men, especially, to see how they can take care of the pressure, because if they don't, they could remain in that trouble.
In that trouble, yes. Yep.
Yeah.
Effectively, yes. Because about erection or sexual life is about blood supply.
Blood supply.
When there's this issue of blood circulation,
And when that supply line,
yes,
the
the blood, you destroy blood to clot
enough blood in there,
in a supply, then
you have a problem.
yes, definitely.
Another one you mentioned, which I wanted to touch a little bit, is heart disease.
Yes.
We all know that heart disease is the leading cause of death all over the world.
Yes.
One person dies every 3 seconds,
Yeah.
minutes,
Yeah.
from heart disease.
Yes.
Now, if high blood pressure is not taken care of, you are you're living by the mercy of God.
Mm-hmm.
Just as you mentioned about 1 out of, I think, 4 or 5 or 7. I don't want to bring another clinic in here now, but when I invite the Jamali people here, I normally bring them here.
Mm-hmm.
Dr. Moses Salawari told me that he went to a particular school to do a test for students free of charge.
Mm-hmm.
Out of the 100 persons tested there, 78 of them, or 78%,
Mm-hmm.
had high blood pressure. It's very scary.
Students,
yes, 78% of them,
mm-hmm.
a particular school around here.
Mm-hmm.
What can you do as Benson Hospital to help reduce this problem?
Yes, first of all, as a healthcare facility, not only treating the condition, we are having some plan of awareness.
Yeah.
Awareness.
Like you are doing now.
Yes, like we are doing now, and then we'll go to communities with a team. The team is already set with the community leaders around us. So we go and educate them on the risk factors, prevention and how to conduct themselves to not develop, these conditions we call high blood pressure.
Okay.
Yeah.
Mrs. Powell, in your upgrading that you're doing now at the hospital, please forgive me each time I want to say clinic, because I normally invite people for other clinics.
Mm-hmm.
Yeah. You mentioned one thing I'm happy about. Sometimes when I listen to the radio and I hear about one man sitting in one corner treating over 100 different illnesses from herbs, and I ask myself, how does he do it? No testing. And the whole thing about medication is not about guessing what. It has to be done properly. And so when you say you have a system now, or the laboratory is upgraded, I'm happy. Tell us more about it.
Good. So,
what in other words, what are some of the tests that you hear out there?
Okay. So right now at Benson Hospital, we are able to do liver and pancreas tests, bone, all the tests for women, obstetric tests, reproductive fertility tests, any like men and women who are unable to have children, infertility, we have the tests. We also have thyroid. We even now do we have microbiology tests, and then we have we have we are now testing drug tests. So if anyone has now with this thing about drugs here and there, we have the full package of laboratory testing to test for the type of the level of the drugs into your system. We do a full scale heart test, lipid profile, electrolytes.
The EKG now.
We have EKG.
EKG,
yeah. We have EKG, but it's another machine.
Oh, okay.
Yeah, so we even do electrolyte testing because sometimes you don't even know the level of sodium or calcium or different levels in your system that keep making you sick. And iron profile. Anemia is a problem in Liberia. So now, in fact, the medical director will be discussing how to start to test pregnant women. Our lab is so sophisticated to a point where it determines the level of anemia you have and what to do. So we have everything in that lab.
Okay.
Yeah.
All right. We're going to come to more of that, but we need to know people who are listening and want to come to do certain tests, and they need to know whether they can come to you.
Sure.
Are you affordable?
Oh, sure. I even have some of the prices here.
You want to name them?
Because we are in a community, we are in a district, although where we are, most of the business people are there, but the people who dwell there do not have money. So if you check some of our prices, the liver function test It's just the whole package.
Yeah.
All the liver function tests, everything put together is around $35.
Can you imagine that?
Yes, no. You can even compare that to other places.
Yeah.
The boom, the full kidney function test is $40. The electrolyte test is $30. When you compare this price to other places,
yeah.
we are like 50% slashed.
Yeah.
I want more people to come. I mean, we are in business though, but
Yeah.
we don't want to drive people away. Yes, so like our microbiology test and things like urine, we're charging $5. Speak of people who got TB and they come,
Yeah.
it's just $35.
All right.
Then of course malaria is simple. What is the complete blood count and things, just $10.
All right.
Yes. So let me talk about the fertility.
Yes.
All the different level of tests. The highest one here, especially for the men, the testosterone is around $40. The rest fall below.
You can bring the paper there so they can be talking in the mic.
Oh, okay. Yeah, so it's around for the fertility test, and just the lowest is above. The highest is around $40.
You know, the fertility issue, thank you for bringing it up. Most people believe that it is only women that can have problem with infertility. They don't know that men too can not pregnant women based on certain conditions. So you do the test for both of them, for men and women.
Yeah.
So we actually, and it's a myth, but the scientific problem actually, and Dr. Ilya can expound it. 80% of the fertility problem
It's men.
is from the men.
It's men. Thank you.
Yes.
Yep.
So we set up our fertility place now where the couple can come and feel like they are at home and they relax when we're doing all of our
Where is Benson located?
Tuporo Outlet Community. When you are going to, it's very close to Sinkisito Church. Yeah, just before you get to Sinkisito Church. Yeah.
Dr. Eli.
Yep.
You know, your name is actually Keys for Healing. Last name, but we prefer calling you Dr. Eli.
Yeah.
Make it simple for us. Please emphasize on some of the things you do.
Yeah, well, the CEO has said it all. For our diagnosis center, the lab, we have a most equipped lab I ever met since my career, almost 2 decades.
If you department and you did all of my tests and recommended what medication I should take, and I was okay after you recommended what I should do. Now, if you can say Benson has what you have never seen before, then I believe you.
Yeah.
Go ahead, sir.
Yes, so as she mentioned, we can do all the comprehensive chemistry tests, and we do all the panel, possible, and moreover, we can do sensitivity tests, culture, blood culture, urine culture, and sensitivity tests. So you come, we collect your blood, we will see which bacteria are growing, and then it will show us which targeted antibiotics to kill that bacteria. So we are treating, right, with the most precision possible. So we know this is your issue, and this is how to treat it. So we are now equipped. We know how to diagnose clinically, and now the lab is supporting. So when you come, your disease will be healed in no time. Yeah.
Mrs. Parwon mentioned something about the kidney.
Yeah.
And the liver. I'm interested in that.
Yeah.
Let's keep up. Some. Okay, is it from me? No? All right. Okay.
Yes, I'm sorry.
All right. Wait. Just put it on a little bit.
Yeah.
Okay. Like I said, you mentioned the kidney and the liver. And those are two important things that I want us to emphasize a little bit.
Yeah.
Because most people have kidney problems and they don't know. Simply because it is asymptomatic. You don't get the problem known too early until it gets worse.
Yeah.
And when it gets worse, my friend, you may not be lucky
It's too late
to do a kidney transplant. You may not be lucky to have money to do dialysis
Mm-hmm.
because those are the two major things that have to be done
Yeah.
once you have a kidney problem. But
Mm-hmm.
sometimes it can be too late.
Mm-hmm.
Now, let's talk about the kidney issue a little bit.
Mm-hmm.
And the worst thing is that some people have one kidney and some have two.
Yeah.
And most people don't know that. Every 2,000 babies that are born around the world, one of them is born with one kidney.
Mm-hmm.
And some people have two, some have one. Let's emphasize that kidney test a little bit.
Yeah. Yes. For the kidney test, we run the full package, you know, and we do the creatinine, the urea, and then we do electrolyte attached to it, and the uric acid. So those are the panel for
You
the
say
kidney
just for
function.
$35.
Yes.
Oh, that's a giveaway.
For $40.
$40.
Yeah. Other places it's 2 times that amount.
Even $50
Yes.
or $100
Yes.
for your kidney,
Mm-hmm.
that's even a giveaway.
It's a giveaway. People should come and do their checkups. You know. Yeah, I like you because you used to come every year for your checkup.
Oh yeah, I still do it. I have done it 9 times.
Yes.
At different hospitals. Benson is going to be one of the places I have to go.
You are
You're
welcome.
welcome.
Yeah, I have done 9 medical checkups.
Yes.
So I don't play with that.
Mm-hmm.
So I'm going to try and come to. Let's talk about the liver test a little bit.
Yes.
Yeah, you do liver tests.
Yeah, we do liver tests. So it is about 5 tests, which we have the LT, AST, the total bilirubin, direct, indirect bilirubin. It's a whole panel, about 7 tests. Other places they can charge for each $10, but for us it's just $35 for the whole panel.
Yeah.
It's really affordable. People need to come and check their livers.
And those of you who are following us, you need to take advantage of that because I know of other places. I have done 9 medical checkups in different hospitals, and I know what I spent. I'm 72 years old now, and I don't want to die right now. I still want to live on. And so I'm going to continue doing my test. I will advise you to do the same because there are some the 8 organs in your body. Some people just say your body is just empty and walking. No. It's like a vehicle. You got 2 red plus spots in a vehicle. If you don't do what I call preventive maintenance, my pickup outside there is 40 years old now because of one reason: preventive maintenance. I don't wait until my tire jumps out, then I call my mechanic. No, I check myself. The center of the human body.
Yes.
I'm interested in the liver and the kidney issue because your liver is the largest organ in the human body. It weighs 3.1 pounds. And it performs over 500 different jobs. Are you going to sit there and allow your liver to be destroyed? You don't have the money for that. Now, let's come back to you, Mrs. Parwon. I want to know about the upgrading. Let's talk a little bit more about the upgrading.
Yes.
In fact, that's why I called you today, but I wanted us to talk about 1 or 2 other things that you do there. Let's talk about the staff first. Is your staff customer friendly?
Yes.
Are there people who are going to yell at the nurse, at the people who are pregnant? You small at it, you're getting pregnant. Huh? What wrong with you? I think people like who kill you even more when you go for medical checkup.
So because I inherited staff, and my intent is not to fire, there might be some instances where there are staff with disrespectful behavior, but we've done some trainings.
Yep.
We've been doing trainings. We train in nurses.
Yeah.
We just completed the nurse aids, and we continuously are training the staff to bring them to. We also have a system in place where we do random calls. Right after patients leave, we call. How was it? Was everybody kind to you? And then they tell us.
Yeah.
And generally, how was the care? How is the hospital? And patients, the last thing they told us was they said the staff were good to them.
Okay.
They only said, "Oh, you need to do something about your bathrooms," and immediately we started to do something about the bathrooms.
That sounds good.
So we have zero tolerance to disrespectful care.
Yes.
And then we are continuously training, our staff.
Okay. Well, let's put it this way. We got to follow our format here. The format is 30 minutes of discussion with my guest, 15 minutes of calls from the public, and then We'll come back to them for 50 minutes to respond to the callers. And this, Dr. Sonia, keep is not screenshot that. You know what we can do. And so I'd like to let you know that we're about to take a break and we'll come back after the break. You'll call this number 0777 511 977. 0777 511 977 or 0886 511 977. After the break, we're going to be doing that. Let's take a short break.